We are all affected by the AIDS pandemic. I cannot rest until I'm certain that the global response is sufficient. It is a tragedy of unprecedented proportions that is claiming more lives than the sum total of all wars, famines, and floods.
HIV infection and consequently AIDS is probably one of the most serious challenges this country has faced.
To date, we have at least 33 million people globally living with HIV. Just over the last year, we had about 400,000 new infections. But coming down to South Africa, South Africa's got the biggest burden of disease of HIV and TB in the world.
HIV/AIDS in South Africa, it's still one of the main hindrances for the development of the country.
We have more than 1,000 HIV-related deaths per day. We have more than 1,600 new infections per day. For every 2 people put on treatment, there's 5 new infections. In our country right now, with nearly 1 million people on treatment, we're only covering 1/3 of the people that need to be on treatment.
Over the past 25 years, the HIV and AIDS pandemic has topped global agendas as infection rates increase daily. In sub-Saharan Africa, challenges with poverty, low levels of education and poor infrastructure perpetuate the spread and devastating impact of HIV and AIDS.
We suffer poverty like most poor countries, but we also certainly have means. I mean, we spent close to about 200 million rand in the last 5 years on HIV/AIDS campaigns.
And although the country has made great strides in the last 2 years, it is still a very, very serious threat to our development.
There was a sense of a curiosity behind, why are we battling to get the numbers down? Why are we not understanding what continues to drive people to be infected, 600 people to be infected on a daily basis, in spite of all the money that's being poured into HIV?
We can make progress on the technical side, for example, treatment. But on the issue of prevention, from day one of response to the epidemic in this country to today, the challenge remains the same, and it is almost, if not as big, if not bigger, than it always was.
The global concern is due to the realization that the impact of the pandemic extends into every sector of society, not only affecting financial, health and education sectors, but ultimately affecting the lives of every man, woman and child on the planet.
Increasingly, we know that AIDS is more than just a health issue, and it impacts on the development of a country.
Not only is it a drain on our fiscus because of the strain on the health services, but the mortality rates are enormous and devastation on communities just cannot be measured.
If you're unemployed and you're at work, if you are sick, you're not able to stand up that morning and go and look for work. So the cumulative effects at a national level of people being ill and sick and not being able to be productive are huge on the economy.
When you look at the impact of HIV and AIDS in the workplace, in terms of absenteeism, if you look at it in schools, in terms of teachers that are falling sick, teachers that are dying, pupils that are also becoming sick, in terms of households that are now being headed by children, it's a catastrophe.
With the strain on health services, both public and private financial sectors, and infection at an early age affecting the education sector, HIV and AIDS is producing astronomical statistics with devastating impact. But over and above the effects at a national level is the personal impact that the disease has had on the individual lives of people.
I've got relatives. 2 of my father's brothers have died, but one is alive with Kaposi's sarcoma. And I've got an auntie who's also living with HIV, is on antiretrovirals.
My uncle was infected with this epidemic. I think it was back in 95, 96.
thotse di ka 1991 kana ka rape.
It affects me a lot seeing abantwana abancane they dying of HIV and AIDS.
When I found out that he was HIV positive and that HIV had no cure, and very soon I would be losing my uncle that I've been close to for many, many years. It was painful.
I have seen my uncle being ostracized to a point where they built a room for him separately. My grandmother built a room for him in Natal, and he had a little bucket where he was spitting up his sputum all the time. And he would use his own everything.
Ke ne ke rejectwa ke each and everybody, even le mme wa ka ntsotseng.
So it's dying in such indignity that is really tearing the whole our souls apart, and that is the disease.
I remember one day he called me. He was like, "Hey, mfana, kuyavaya mfethu."
When you have a member of a family affected by HIV/AIDS, it's a very personal thing, because you start taking a little bit of the blame to yourself, because you think, I know enough to have stopped this.
I have people who've died of HIV and AIDS, and it's affected me a lot, because when I come to think of what did I do, angenzanga okwanele for them ukuthi bakwazi ukuthi basizakale, and maybe I should have done more. Maybe I should have prevented some of the things that happened to them, because I would advise them of going for testing and taking ARVs early at the early stage. So that did not happen.
We share a common humanity with our brothers and sisters suffering in this epidemic. We are all affected by the AIDS pandemic.
The biggest challenge that we face is we need to change our approach.
The problem with HIV hasn't been that there is no intervention. There's always been intervention. I mean, there are antiretrovirals. Eventually, since 2005, people are receiving free drugs. In the media, everywhere you look, in the newspapers, TV, documentaries, all sorts of things. They're all there. The intervention is there, but still people are getting infected. What is the problem here?
We often look at it as a medical thing. There's so many other issues that surrounds how people ultimately, as individuals, behave and ultimately change behavior. It is informed by the context of their lives, the immediate context of their lives, who they are, and all those issues that surround that, be they social, cultural, political, economic even.
We've always thought that, sex is an individual effort, or an effort of two people, and we've tried to address it to the two people. But sexual behavior is informed by what happens in society, cultural practices, and trends.
It's about intimacy that goes beyond community health and goes beyond public health. It's about relationship health, because we know that the virus is transmitted in the bedroom, mostly.
When the sexual act happens, the billboards are not there, the radio messages are not there, the TV ads are not there. Ultimately, when the actual act happens, it's a personal and an individual decision to take the choice between being safe or not. And of course, we take cognizance of the drivers, like poverty or issues of rape, violence, and all other contextual issues where people are affected, where they probably were not in a position to make a decision.
We need to deal with the social aspects of HIV if we're going to have an HIV-free generation.
With the awareness and understanding that traditional informative methods about prevention are not producing adequate intervention, the Nelson Mandela Foundation have looked to changing the behavior of individuals in order to create meaningful, sustainable change in communities. Inspired by the humanitarian icon and founder, The Nelson Mandela Foundation uses the indomitable legacy of Nelson Mandela in the center of memory, together with his approach through dialogue to bring about social change with community conversations.
Talking about the problems in a very, very open and transparent manner can empower people to understand their problems far better. I think that's the difference between the community dialogues and the other advocacy messages, as the communities themselves are talking about what it will take to stop the spread of this disease.
They are a process that allows the community members who are experiencing these challenges to find their own solutions and feel empowered to bring about their own decisions.
The process of engaging communities in dialogue is implemented through the Community Capacity Enhancement methodology that empowers communities to tackle their own specific challenges from a bottom-up approach.
The methodology is adapted from something that the United Nations Development Programme pioneered over the years in other parts of the world.
Give credit to the way that Africans have handled their meetings from way back. In the times of our forefathers, we would have lekotlas or imbizos under a tree, but decisions were made there and societies were controlled.
And we then fashioned this program to go out to communities through this methodology that has been used around the world by UNDP, called Community Capacity Enhancement.
Community Capacity Enhancement is about really focusing on identifying challenges around HIV and AIDS or any social justice issue and coming up with solutions as a community.
Once we then start having conversations as everybody in the community, then we can then have a sense of direction as a community, you know, to achieve whatever that we want to achieve.
When we talk of CCEP, we're talking of a 6-step methodological movement, a cyclical movement. So it's establishing relationships, it's identifying concerns and exploring those concerns, and then making decisions on those concerns, and then acting on the concerns. Then you go back to review what you've been doing. And this is something that this cycle is done by the community.
To see results at a national level, it is necessary to understand the specific challenges that further the spread of HIV and AIDS at a community level. Through their Community Conversations program in various rural, peri-urban and urban areas in South Africa, the Nelson Mandela Foundation has uncovered various factors that influence HIV and AIDS in each area.